is Zharkyn Moldokulova, and in collaboration with Dr. Elena Molchanova and Dr. Elena Kosterina, we investigated how primary healthcare providers in the Kyrgyz Republic perceive anorexia nervosa and people affected by it. We focused on primary healthcare providers because their viewpoints shape the entire process of treatment, given their role as accessible first-line specialists for the local population. We assumed that the perceptions of our participants about anorexia nervosa might differ from its clinical reality, yet the methodology we adopted required diving into the study with open-minded curiosity. We started by exploring anorexia nervosa in non-Western contexts. Utilizing interpretative phenomenological analysis, we conducted 6 semi-structured interviews with 6 general physicians. The interpretative phenomenological analysis is widely used in healthcare research for unveiling personal experiences associated with various medical conditions. Through in-depth analysis, we extracted 4 overarching themes across the interviews. The first theme revealed that the participants perceive anorexia nervosa as a response to psychological distress, manifesting as loss of appetite. In the second theme, the participants assigned blame for the development of anorexia nervosa to the family members of affected individuals. The third theme centered on the impact of socio-cultural pressures on the development of anorexia nervosa. The fourth theme revealed that the participants perceive individuals who have anorexia nervosa as those who deny having a mental health disorder. The conclusion, rooted in the theory of social constructionism, suggests that the perceptions of our participants mirror a collective understanding of anorexia nervosa in the local societal context. We also found that the participants face challenges in addressing such complex disorders as anorexia nervosa and eating disorders overall. Recognizing anorexia nervosa in diverse contexts is vital for developing inclusive approaches to diagnosis and treatment. This study can serve as a basis for further research on eating disorders in Central Asia and contribute to development of training programs for healthcare providers. Further research will be quantitative and include data from this study to collect generalizable data to identify specific gaps in knowledge on anorexia nervosa among Kyrgyz primary healthcare providers.